41. TB can cause pleural effusion in extrapulmonary disease. True or false? Answer: true. Rationale: pleural effusion is a common presentation of extrapulmonary TB resulting from pleural infection by Mycobacterium tuberculosis, per clinical manifestations. 42. Second-line TB drugs are more effective than first-line drugs. True or false? Answer: false. Rationale: second-line drugs, e.g., fluoroquinolones, are less effective and more toxic than first-line drugs, used only for resistant TB, per WHO treatment guidelines. 43. The nurse should monitor for hearing loss in patients taking streptomycin. True or false? Answer: true. Rationale: streptomycin, a second-line TB drug, can cause ototoxicity, leading to hearing loss, requiring auditory monitoring per pharmacological side effects. 44. TB transmission is more likely in well-ventilated areas. True or false? Answer: false. Rationale: TB transmission is more likely in poorly ventilated, crowded areas, as airborne droplets linger longer, per CDC transmission risk factors. 45. Patients with latent TB should receive a 6 to 9 month course of isoniazid. True or false? Answer: true. Rationale: a 6 to 9 month course of isoniazid is a standard treatment for latent TB to prevent progression to active disease, per CDC treatment guidelines. 46. Active TB always presents with a productive cough. True or false? Answer: false. Rationale: active TB may present with a non-productive cough, systemic symptoms, or extrapulmonary manifestations, not always productive cough, per clinical variability. 47. The GeneXpert MTB/REF test can detect rifampin resistance. True or false? Answer: true. Rationale: the GeneXpert MTB/REF test is a molecular assay that detects Mycobacterium tuberculosis and rifampin resistance, aiding rapid and DRTB diagnosis, per WHO Diagnostics. 48. TB treatment can be safely stopped if symptoms resolve after 1 month. True or false? Answer: false. Rationale: TB treatment must continue for the full 6 to 9 months, even if symptoms resolve, to ensure complete bacterial eradication and prevent relapse, per WHO guidelines. 49. Diabetes mellitus increases the risk of developing active TB. True or false? Answer: true. Rationale: diabetes impairs immune function, increasing the risk of latent TB progressing to active disease, per CDC risk factor data. 50. A negative TST rules out TB infection in immunocompromised patients. True or false? Answer: false. Rationale: immunocompromised patients may have false negative TST results due to weakened immune responses, requiring additional tests like IgRA, per CDC Diagnostics. 51. The nurse should teach TB patients to take medications on an empty stomach. True or false? Answer: true. Rationale: many TB drugs, like isoniazid and rifampin, are better absorbed on an empty stomach to maximize efficacy, per Pharmacological Administration guidelines. 52. TB is a reportable disease to public health authorities. True or false? Answer: true. Rationale: TB is a reportable disease to enable contact tracing, surveillance, and outbreak control, per CDC public health mandates. 53. Extrapulmonary TB is more common in immunocompetent individuals. True or false? Answer: false. Rationale: extrapulmonary TB is more common in immunocompromised individuals, such as those with HIV, due to impaired immune control, per CDC epidemiology. 54. The BCG vaccine increases the risk of a positive TST result. True or false? Answer: true. Rationale: the BCG vaccine can cause a false positive TST result, especially in recently vaccinated individuals, necessitating IgRA use, per CDC diagnostic considerations. 55. Active TB patients should avoid sharing utensils to prevent transmission. True or false? Answer: false. Rationale: TB is not transmitted through sharing utensils, as it spreads via airborne droplets, not fomites, per CDC transmission routes. 56. Pyrazinamide can cause hyperuricemia as a side effect. True or false? Answer: true. Rationale: Pyrazinamide inhibits uric acid excretion, potentially causing hyperuricemia and gout, requiring monitoring per pharmacological side effects. 57. TB can cause miliary TB, a disseminated form of the disease. True or false? Answer: true. Rationale: miliary TB is a severe, disseminated form of TB with widespread organ involvement, often seen in immunocompromised patients, per clinical manifestations. 58. All patients with active TB require surgical intervention. True or false? Answer: false. Rationale: most active TB cases are managed with multi-drug therapy. Surgery is rare, reserved for complications like abscesses, per WHO treatment protocols. 59. The nurse should assess for weight loss in patients suspected of TB. True or false? Answer: true. Rationale: unexplained weight loss is a common symptom of active TB due to systemic inflammation and increased metabolic demand, per clinical assessment guidelines. 60. TB treatment regimens are the same for children and adults. True or false? Answer: false. Rationale: pediatric TB treatment regimens may differ in drug dosing and duration, adjusted for weight and age, per WHO pediatric guidelines. 61. A sputum smear positive for acid-fast bacilli confirms TB diagnosis. True or false? Answer: false. Rationale: a positive sputum smear suggests TB but requires culture or molecular confirmation, as other mycobacteria can be acid-fast, per CDC Diagnostics. 62. Patients with active TB should receive the BCG vaccine. True or false? Answer: false. Rationale: the BCG vaccine is contraindicated in active TB, as it is a live vaccine and ineffective in treating active disease, per WHO vaccination guidelines. 63. TB can cause lymphadenitis in extrapulmonary disease. True or false? Answer: true. Rationale: TB lymphadenitis, often affecting cervical lymph nodes, is a common form of extrapulmonary TB, per clinical manifestations. 64. Rifampin is safe for use in patients with severe liver disease. True or false? Answer: false. Rationale: rifampin is hepatotoxic and contraindicated or used cautiously in severe liver disease, requiring alternative regimens, per pharmacological precautions. 65. The nurse should teach TB patients to avoid alcohol during treatment. True or false? Answer: true. Rationale: alcohol increases the risk of hepatotoxicity from TB drugs like isoniazid and rifampin, necessitating avoidance, per patient education guidelines. 66. TB is less contagious in patients with extrapulmonary disease. True or false? Answer: true. Rationale: extrapulmonary TB is generally less contagious than pulmonary TB, as it does not involve active lung bacterial shedding, per CDC transmission principles. 67. The T-spot TB test is a type of interferon gamma release assay. True or false? Answer: true. Rationale: the T-spot TB test is an IGRA that detects TB infection by measuring T-cell response to TB antigens, per CDC Diagnostic tools. 68. Latent TB treatment is mandatory for all diagnosed individuals. True or false? Answer: false. Rationale: latent TB treatment is recommended but not mandatory, depending on risk factors, e.g., immunosuppression, per CDC treatment guidelines. 69. TB can cause vertebral osteomyelitis, known as Pott's disease. True or false? Answer: true. Rationale: Pott's disease is TB of the spine, causing vertebral osteomyelitis and potential deformity, a form of extrapulmonary TB, per clinical manifestations. 70. Patients with active TB should wear surgical masks in public. True or false? Answer: true. Rationale: surgical masks on active TB patients reduce droplet spread in public settings until they are non-infectious, per CDC infection control. 71. Isoniazid is used to treat MDR-TB. True or false? Answer: false. Rationale: MDR-TB is resistant to isoniazid, requiring second-line drugs like fluoroquinolones or bedaquiline, per WHO MDR-TB treatment guidelines. 72. TB screening is recommended for recent immigrants from high-burden countries. True or false? Answer: True rationale. Recent immigrants from high TB burden countries are at increased risk, necessitating screening with TST or IGRA per CDC public health protocols. 73. A chest X-ray showing hilar lymphadenopathy is suggestive of TB. True or false? Answer. True rationale. Hilar lymphadenopathy on chest X-ray is a common finding in primary TB, especially in children, per radiologic findings. 74. TB treatment can cause photosensitivity as a side effect. True or false? Answer. True rationale. Rifampin can cause photosensitivity, increasing sunburn risk, requiring patient education on sun protection per pharmacological side effects. 75. Active TB can be diagnosed solely based on clinical symptoms. True or false? Answer. False rationale. Clinical symptoms alone are insufficient for TB diagnosis, requiring microbiologic or radiologic confirmation per CDC diagnostic standards. 76. The nurse should monitor for gastrointestinal upset in patients taking rifampin. True or false? Answer. True rationale. Rifampin can cause nausea and abdominal pain, requiring monitoring and patient education on taking it with food if needed, per pharmacological side effects. 77. TB can cause meningitis in immunocompromised patients. True or false? Answer. True rationale. TB meningitis is a severe extrapulmonary form, more common in immunocompromised patients, with high morbidity, per clinical manifestations. 78. All TB patients require a 12-month treatment regimen. True or false? Answer. False rationale. Standard active TB treatment lasts 6 to 9 months. Longer regimens, e.g., 12 to 24 months, are for MDR-TB or complications, per WHO guidelines. 79. The nurse should teach TB patients to report yellowing of the skin. True or false? Answer. True rationale. Yellowing of the skin, jaundice, may indicate hepatotoxicity from TB drugs like isoniazid or rifampin, requiring immediate reporting, per patient education. 80. TB is more prevalent in low-income populations. True or false? Answer. True rationale. Low-income populations face higher TB risk due to poor living conditions, malnutrition, and limited healthcare access, per WHO epidemiology.